We're so excited to be here with the Morehouse School of Medicine, the Kennedy Forum, kicking off a great partnership to tackle mental health and substance abuse disorders in this country. Morehouse has such a fantastic reputation in primary care and public health and community engagement, and that's why we decided to partner with Morehouse School of Medicine.
You know, this is an extremely important engagement, a cause that is shared by our partner. It is a significant issue not only to our institution, but to this country. What I'd like to do now is introduce the two major partners in this regard. Let me ask the former congressman to come up and say a few words. Patrick Kennedy.
You know, my dad was most known for nearly 5 decades in the Senate. I was so honored that the last bill that I was able to work on with my late father was the Mental Health Parity and Addiction Equity Act, which was signed into law. On the desk that John F. Kennedy used when speaking to the nation as the first president of the United States to address the subject of civil rights. That year that he gave that address was the same year that he signed the Community Mental Health Act into law. And it was the very last bill that he signed as President of the United States. In that signing ceremony, he said the mentally ill need no longer be alien to our affections or beyond the help of our communities. He didn't say beyond the help of our hospitals, beyond the help of our psychiatrists, beyond the help of our medical community. He said beyond the help of our communities. 50 years later, they're still institutionalized. They're institutionalized in our jails, in our hospitals, in homeless shelters. And frankly, I think we're at an opportune time to make historic change on President Kennedy's vision. And I'm so honored that that change is going to be happening in a place that bears my family's name, at Morehouse School of Medicine, with David Satcher as our leader.
To all of you who are here, how delighted we are to have you. It's really a great start. The people who are here and the enthusiasm with which you've joined us, it means a lot. I could talk all night about the Kennedy family, but I won't. I'll just say one thing. So the whole issue of civil rights, which I had an opportunity to work as a student, and now to be able to work with Patrick on the civil rights of the mentally ill. It's an amazing experience. I can't tell you.
I am really excited about what we are embarking on. Morehouse School of Medicine has a strong commitment to engage in the community. And I know that through the Satcher Health Leadership Institute, we have the competency to be successful. I know that through the Kennedy Forum, we have resources and opportunity to understand the national landscape and be able to marry the two. Health equity for all sectors of the population is at the heart of what we are trying to achieve at Morehouse School of Medicine. So it is very much fitting for us to stand here with Bill and the Kennedy Forum, sharing the excitement of joining forces to announce the creation of the Kennedy Center for Mental Health Policy and Research at Morehouse School of Medicine. This collaborative partnership will increase the visibility of mental health policy issues and solutions by engaging the public and policymakers and what we describe at Morehouse School of Medicine so intimately, the community. We cannot do this without the engagement of the community. That community will not have borders. That community will not be defined by race and ethnicity. That community will not be defined by where people live, what zip code they happen to reside in. That community will be broad and it will be inclusive because we understand That's the only way you get to promote health equity.
I do want to remind us that this starts with mental health, that none of us can take our mental health for granted, and we ought to work very hard to make sure that we have a system in place that takes care of everybody who has mental health problems.
This is a bipartisan issue, and this needs to be, and it is. It affects all families in America, and that's what we need in order to get the change politically that we're seeking.